So could you tell me a little bit about Manchester University NHS Foundation Trust?
Yep. So Manchester NHS Foundation Trust is one of the largest trusts in England, NHS trusts in England. It has 10 hospitals across it's the organisation and also community health and some social care services as well. So delivery across the Manchester footprint of district general hospital services, which are more standardised NHS services, but also delivering highly specialised specialist services as well as research and development. Across the organisation, we've got Manchester Royal Infirmary, Wythenshawe, and North Manchester General Hospitals, which are adult hospitals. And we've also got St Mary's Clinical Service, which is our women's hospital and services, and that delivers across all of our sites. We've got the Eye and Dental Hospital, and we've got the Children's Royal Manchester Children's Hospital as well. And then we have a function called CSS, which is Clinical Specialised Services, and what that delivers are support services such as anaesthetics, AHPs, which are your therapists and allied health professionals, pain management services, and pharmacy and labs. So that's a big division, but is obviously present in all of our sites. And then we've got our LCO, which is our local community organisation, and that provides the community services across Manchester and Trafford. It's about 30,000 staff across the organisation. So large, complex, and exciting, loads of opportunities.
So we're going to talk today about EPR, so electronic patient records.
Yep.
And I think the first thing, just from hearing what you said then, it scares me as an outsider who delivers technology projects, is just the sheer number of processes that each of those different departments, sub-organizations must have, and the complexity involved in that. So could you tell me a bit about, I think how that EPR fits into that kind of structure?
Yeah. So the EPR is a key enabler to kind of reduce that variation, because you're absolutely right. You've got all of those different sites and teams within those sites delivering services. And prior to having a single EPR across the trust, we had over 80 different clinical systems and paper as well. So we had a lot of paper records, and we had the multiple clinical systems. So within that, you've got inherent variation, even if everybody used the systems in the same way, which we know that workarounds are really prevalent across every industry. So, a piece of technology doesn't stop the human behaviour. So we had huge amounts of variation. Loads of different, as we say, over 8 clinical systems. We also had 3 different PAS systems. So the PAS system is the patient administration system, and that's actually the system where you manage your waiting list and book your appointments. We have 3 different PAS systems, which is quite significant. So what we have had the opportunity to do with a single electronic patient record is reduce the variation. So when we built the EPR, and I'm sure we'll talk about how we approach that, what we're able to do is that's the same for every site. So we didn't build it differently for Manchester Royal Infirmary and different for Wythenshawe or North Manchester, for example. The build is the build. So we've got the real opportunity for standardisation, which improves efficiency, improves effectiveness, improves outcomes, because you're able to apply best practice. From a change management perspective, there is still a lot of work to do around human engagement and behaviour with that system, because they can still work in workarounds with any kind of electronic system. So the huge amount of variation that we did have, we've managed to reduce down, and we still have work to do to make sure that we're optimising that. So in our programme, we went from a go live position to stabilisation, and we're now moving into optimisation. So how do we really make the best of that? So huge amount of variation, which we've managed to reduce for patient benefit.
Okay. Wow. Okay. When we talk about EPR generally, because I don't know much about that, I can imagine like doctors taking electronic notes, being able to move information around quite easily.
Yeah.
How much impact does an EPR have on a trust? What aspects of normal day-to-day work does it go into?
So it is significant, and it does depend on where a starting point of a trust will be. But when we've deployed Epic as the platform, that is an all-encompassing patient clinical record. So for us, it is the whole patient journey. So from the moment a patient enters the hospital, whether that be through A&E or through an outpatient appointment, etc., the whole journey for that patient is now recorded in the electronic patient record, which is one single version of the truth. So what I mean by that is all the documentation by the doctors, by the nurses, by the therapists, but it is also asking for diagnostics like blood tests or x-rays. That's all processed through the same system, and the results are processed through the same system. So it is all absolutely accessible within one single patient record. Placed in a referral to then ask for an outpatient appointment is within the same system, and the PAS, so we talked about having 3 different PASs before. The PAS is central to the clinical record, so that's now fully integrated. So all the appointments are booked and scheduled, so everything is linked to your waiting list, but also to your clinical record. So the real benefit of that from a clinical perspective is that everybody can see everything. Obviously, you've got security settings, so you can only see what you need to see within your role. But if a patient attends Manchester Royal Infirmary on Thursday of this week and then arrives at North Manchester General next week, the clinicians can see the same information, so all the history of the treatment they've accessed in one place without having to request access to records or going into one of the plethora of systems that we had previously. So what you've got is easy access to real-time data and information at the touch of a button. And from a patient perspective, what that means is less duplication on repeating your information. So if any of us have been to any kind of healthcare appointment, you get asked the same questions all the time. That doesn't mean that the clinicians won't cross-check information with you, because absolutely they have to, but they've got access to that information. But one of the biggest benefits that we're seeing from the EPR for the patient is we've got an integrated patient portal. So it's called My MFT, so that's the patient access. So patient can access all of their results through the portal. They can see all of their letters that are sent to them and sent to the GP, for example. So any discharge summaries or outcomes of appointments, it's immediately available to them through the portal. And we have just started pilots in individual services for wider rollout around self-scheduling. So being able to book your own appointment, cancel your own appointment, move your own appointment, which is what we're used to in everyday life, for your hair or for a taxi, but it's not absolutely easily accessible in healthcare. So we're starting to see some real benefit from the patient taking that ownership. So it's really changed the clinician's journey and also the patient journey.
Wow. I didn't know you could do that for hair appointments. That's amazing.
You can, Richard. And you obviously go often.
Very.